Now to, I guess you could call him the man of the hour, among the key individuals of the hour. I'm talking about the chief medical officer at Moderna, Dr. Paul Burton, with us now. Doctor, very good to have you.
Good afternoon, Neil. Thanks for having me.
How bad do you think this is, Doctor?
So, Neil, look, we know more today than we did on Thanksgiving Day, but I think it's a severe, serious variant. As we just heard, when this started, there were maybe 200, 250 cases a day in South Africa. There's probably 25,000 cases a day, 88,000 cases in the UK yesterday. So it clearly transmits very quickly. Delta typically does not reinfect people who have had Delta, whereas Omicron has no respect for that. It can reinfect people regardless of what they've received. And I think it's true that in terms of death, mercifully, the death rates are lower that we're seeing right now. But look at the data from Denmark. Hospitalization with Delta about 0.7%. It's early days still, but about 0.8% with Omicron. So I think this is a significant variant.
You know, you had said, Doctor, that in looking at, Omicron and where it's going, that it is obviously a seriously transmissible disease. It's not serious in that if you have it, you're going to die from it or certainly be in great peril. But it is very, very contagious. And worldwide, we see that playing out. Where do you see this going?
I think, Neil, the real issue with Omicron is its transmissibility. About 14% of the people hospitalized in South Africa today are either on ICU or a high care unit. So it does have the ability to hospitalize people for sure. And as it comes now into the Northern Hemisphere, where we have different demographics, people with comorbidities, as they get infected and perhaps on a background, let's not forget that Delta is still very, very present in the US and around Europe. That as those people get infected in very large numbers, is going to simply strain an already burdened healthcare system. So I think that's the issue, and that's what we have to protect against with simple measures and with vaccination and boosting as well.
All right, so whatever is out there is existing treatment out there. I know Duke and the NIH have looked into a study that shows booster shots are highly effective at dealing with this, including Moderna's. But I'm just wondering, is there anything Omicron only related or targeted only for this that would be beneficial or is down the pike anytime soon?
So, Neil, today, I think the best thing we can do are the simple measures: hand washing, mask wearing, some distancing. Get vaccinated and get boosted, get educated. Websites like makeityourvaccine.com, people can learn, get educated. It's powerful. Down the road, we at Moderna are working on an Omicron-specific booster. We announced that at Thanksgiving. We continue to do that. We're a leader in the field of mRNA and vaccine therapeutics. And, it's our responsibility to do this. We don't know where Omicron is going. We take the responsibility seriously, and we're working on that vaccine.
So what does that mean, Doctor? When we see these studies that say a booster shot, yours included, would be 50 times more effective at dealing with Omicron, does that mean that the third shot or a fourth shot is in order? What are we looking at here?
I think it is confusing now. I think what the data broadly tell us today is that after 2 shots, compared to your 2 initial vaccinations, if you get a booster, you can ramp up the levels of antibody by maybe 50-fold, which is great. Gets you into a zone that's likely protective. It will get people through the holiday season and through the winter months. As we then go into next year, we'll have to see what the data show around the world from all sorts of different centers, academic independent centers. Do we need a 4th dose, a 4th booster then? When will we need it? How will we want to use an Omicron-specific booster? I think those are questions, Neil, that we just don't have the answers to yet, but will be critical.
Do you think some of the measures that are being taken worldwide, Doctor, including France now, putting a lid on visitors from Britain because of the spike in Omicron cases there, or a lot of businesses in the United States keeping remote work going for at least the next couple of months. In the case of Apple, an indefinite extension of such policies. Today we learned, Doctor, that at the Radio City Christmas show going on. 4 shows were canceled today because one or several of the cast members had Omicron. I'm just wondering if this and these type of reactions are actually making people more anxious.
Well, look, I think they probably are. I think the data are making people anxious. You mentioned it earlier, you know, it's doubling at maybe every 2 to 3 days compared to 7 to 14 days. Transmission is very high. I think what everybody has to do, what governments are trying to do, states, governments are trying to do, is to protect their healthcare systems. They want to try and keep beds open throughout winter. People will get sick from many other things, and we need to protect everybody. So the measures that are being taken, I think, are very important. We can do those simple things, but this is not a time now to let our guard down.
You know, there are a lot of people who you would think, Doctor, hearing of this latest news in Omicron would be more emboldened to get vaccinated. They haven't been vaccinated. But we're hearing a good many saying this is proof that I shouldn't get vaccinated, because even for those who do and are, they have breakthrough cases. And I'm just wondering how you answer that.
So, Neil, I would say this. Look, tomorrow actually is the 1-year anniversary of the authorization of the Moderna vaccine. And to date, around the world, we have given 380 million doses of that vaccine. It's highly effective, it's safe, and will protect people. The vaccines as a whole have prevented 1 million deaths and 10 million hospitalizations, and they've been highly effective throughout Delta. They've kept people safe and they've saved lives. We're in the situation now where we have this new wrench in the system, which is Omicron. But if you get boosted, the good news is you'll get antibodies that will be impactful against it. You will get protection throughout the holiday and the winter months. And then we'll move into 2022, and we can regroup and think about the Omicron-specific vaccine. But I would say to those people, now is the time to get vaccinated and get boosted. There's never been a more important time to do it.
Finally, Doctor, when you talk about now's the time to get boosted, I mean, is it risky to assume that you can get a yearly booster, that the efficacy of a lot of these shots, I'm not trying to lump you in with your competitors here, is such that it might have to be several times a year?
I think at the minute, Neil, nothing is really off the table. We just don't have those pieces of data yet. I would say we've always thought as a company that a yearly booster, perhaps coupled with flu, we're working on that, would be the likely course to get out of the pandemic and into the endemic phase. Does it need to be more frequently than that? I don't think we will know the answer to those questions until springtime or a little later.
Dr. Paul Burton, very good talking to you, sir. Thank you for taking the time.
Thank you, Neil.